Hi, I'm Craig Davis along with Dusty Darr from AARP Oklahoma, and we wanted to give you a wrap-up on the 2012 legislative session. All done and everything's over with for this session, Dusty?
All done. We had an exhilarating session, but I'm glad to say that we're in the interim now.
Okay, so let's talk about some of the wins for AARP. House Bill 2566.
House Bill 2566, that was probably the second priority bill that we had the governor sign this year. It was really exciting. That measure was authored by Representative Harold Wright of Weatherford and Senator Tom Ivester, and what brought that bill along was a couple of assisted living facilities out in western Oklahoma were charging really high monthly fees to their residents if they decided to use their own pharmacy or other providers of medical services as opposed to the provider that the facility proposed that they use. What we ended up seeing there was that residents were paying as much as $150 a month to use the same pharmacist they've used for years and years. We felt like that was bad policy, and what this bill does is it basically says that an assisted living facility cannot penalize a resident for continuing to use their choice of doctor, pharmacy, or other suppliers of medical services. This is a pretty big win for the assisted living residents of Oklahoma.
Okay, so that bill's been signed by the governor and then goes into effect in November.
That's correct. It's effective November 1st.
Okay, another big win, House Bill 2582.
Yeah, that's a really big win for us. As most of our volunteers know, this bill really kept us busy from the get-go this session, practically till the very end. House Bill 2582, authored by Representative Jeannie McDaniel of Tulsa and Senator Tom Adelson, also of Tulsa, will basically require that long-term care providers execute a fingerprint-based nationwide background check on all future employees that are going to have direct access to patients. Most of the long-term care facilities that are covered by it would include nursing homes, assisted living facilities, residential care facilities, hospice, and also home care providers. As many folks might recall, the home care industry adamantly opposed this legislation every step of the way. On numerous occasions, our volunteers really rose to the occasion and helped snatch this bill from the jaws of defeat. We were able to ultimately broker a compromise so that there was no fee increase to anyone whatsoever. This is a really big win. I would note that the reason we felt so strongly about this bill is because currently in Oklahoma, long-term care providers do a background check, but that background check is very limited in scope. It only applies within the state, and it only focuses on an individual's name. So it's a name-based statewide background check. There's many instances of cross-border activity in these industries because if you're a nurse or a nurse aide, it's really easy for you to cross the border into another state and work there and find employment readily available. So making sure that we have a broader scope of a background check in place is crucial. And I would also add that just about a month ago, it was reported in the news that there was a long-term care worker in Guthrie who was charged with raping 5 residents. And this gentleman, after doing a background check on him, it was revealed that he was charged with manslaughter and other adverse findings in the state of Michigan. And had this bill been in place then, that would have precluded him from being employed. So we feel very good about this bill, very appreciative to all our volunteers for their work on it, and for Jeannie McDaniel for really working hard on it.
And I know the volunteers are going to celebrate a little bit next week at a reception at the Capitol after the governor has a ceremonial bill signing on House Bill 2582 as well.
That's right. Governor Fallon signed the bill, the fingerprinting bill 2582, last Friday, the 8th, and she has so graciously agreed to host a ceremonial bill signing for both the fingerprinting bill and also House Bill 2566. So we're inviting all of our volunteers and staff to be there for those bill signings. It's just a great opportunity to celebrate this positive legislation.
And one other win is House Bill 2270.
That's right. House Bill 2270 is a really significant win. It was a win that we didn't necessarily engage all of our volunteers on a continual basis. It didn't have that much opposition. But this bill is really significant because what it does is it goes into statute and it modifies the fee for the nursing care quality of care fee, and it's going to raise that to about $19.4 million or so for the state. The state will then be able to use that increase to leverage about 34 some odd million dollars in federal funds for a grand total of about $53.6 million. Those funds will then will be used to increase staffing in Oklahoma's nursing homes. That's what we're very hopeful for anyhow. It's a really positive step.
Thanks for the updates, Dusty. I know it's a lot of complicated issues, and we've worked on a lot of different issues this session, but I appreciate you. And I'd just like to encourage all of our members and anyone that's interested to continue to check our YouTube channel, our Facebook page. It's a great way to follow in real time what's happening, because we do posts on our Facebook page and our Twitter page to keep people updated, not just on our legislative issues, but on all the issues that we work on here at AARP Oklahoma. So I think that's all for our update now, and we just remind you to visit our webpage at aarp.org/Oklahoma.